Imagine this. You've been struggling with ED for a while. Pills didn't work, side effects were rough, and you're thinking, now what? What if I told you there's a safe, drug-free option you can use at home? No surgery, no complicated procedures, and it's helped thousands of men regain their confidence. It's called a vacuum erection device, or VED, and today we're going to break down exactly how it works, the pros and cons, and tips so you can get the best results possible. What exactly is a vacuum erection device? A vacuum erection device is a medical tool designed to help men with erectile dysfunction achieve and maintain an erection. It's made up of three main components: Transin transparent cylinder that fits over the penis, AC pump, either manual, hand-operated, or battery-powered, acyl constriction ring, also called a tension ring, that keeps the blood in place after pumping. These devices are not some new gimmick. They've been around for decades, and they're even prescribed by doctors for men recovering from prostate surgery. Chapter 2. The science behind it. Here's the process in simple steps. 1. The liander is placed over the penis, forming a seal at the base. 2. The pump removes air from inside, creating negative pressure. 3. Third, vacuum pulls blood into the erectile tissue, causing the penis to swell and harden. 4. Once an erection is achieved, a constriction ring is slid down to the base of the penis to trap the blood inside. 5. Uvetum is removed, and the erection can be maintained for up to 30 minutes for sexual activity. What's interesting is that this method works independently of nerve function, so even if ED is caused by nerve damage, the pump can still produce an erection. Chapter 3. Who can benefit from a VED? The fan who can't take ED medication due to heart problems, high blood pressure, or drug interactions. The friend who didn't respond to pills like Viagra or Cialis. The recovering from prostate surgery to promote blood flow and prevent shrinkage. This who want a non-invasive, affordable solution they can control themselves. Chapter 4. Benefits that make it worth trying. No medication side effects like headaches or dizziness. Works almost immediately once you get the hang of it. It'd be combined with other ED treatments for better results. Long-term cost savings compared to continuous prescription drugs. Manually help improve penile health over time by promoting blood flow. Chapter 5. Downsides and limitations. Our learning curve. It takes practice to get comfortable using it. Erection may feel cooler and less natural because of reduced blood circulation. Possible mild side effects: bruising, numbness, or discomfort if misused. Constriction ring must be removed after 30 minutes to prevent injury. Not for men with bleeding disorders or certain blood clotting issues. Chapter 6. Tips for best results. Water lubricant for comfort and better suction. Prove using it during intimacy, the natural learning file as rule. 5. List how this term is water tension ring size. It too loose and it won't work, too tight and it may hurt. Lean your device after each use to prevent infections. In doubt, consult your doctor for guidance on proper use. Chapter 7. Final thoughts. A vacuum erection device might not be the sexiest looking gadget, but for many men, it's a game changer. It's safe, effective, and puts control back in your hands, literally. If pills aren't working for you, or you simply want a drug-free option, this could be your ticket back to a confident, satisfying sex life. Always follow your doctor's advice, and remember, solutions are out there. You just have to find the one that works for you.